Good afternoon, everyone, and thank you for tuning in to our latest webinar, Functional Fitness, Exercise, and Diabetes. Today's webinar is sponsored by the Good Health Gateway. Today, information about exercise and fitness is everywhere. While physical activity is an important part of healthy living and something that is certainly deserving of attention, the abundance of information at every turn can be overwhelming. Now, couple that with a diabetes diagnosis, and knowing where to start or the best practices for your exercise regimen isn't always easy. We are here to help. We hope to provide you with some simple, straightforward tips to safely incorporate exercise into your life as a person with diabetes. Whether you are just starting out or have been managing diabetes for a while now, we have some great recommendations for everyone. Physical activity is very important for everyone, and even more so for individuals with diabetes. And the good news is it's not as difficult as you might think. If you have diabetes, being active makes your body more sensitive to insulin. Insulin is the hormone in your body that triggers your cells to use blood glucose for energy. So, physical activity is a tool that can be used to effectively lower your blood glucose levels. Plus, physical fitness can be attributed to lower risk of heart disease and nerve damage for people with diabetes. Physical activity has been linked to numerous other benefits which help you to live and feel well, including maintaining a healthy weight, losing weight if needed, feeling happier, sleeping better, improving your memory, controlling your blood pressure, lowering your LDL or bad cholesterol, and increasing your HDL or good cholesterol. And yet, despite all of these great benefits, less than 25% of people with diabetes reach the recommended weekly goal for physical activity. If you are not regularly exercising and moving your body, you could be leaving all of these amazing health benefits on the table. But where to start? Safety first. Before starting any new exercise regimen or workout plan, it is always best to check in with your doctor. That's especially important for people with chronic conditions like diabetes. Your doctor can help you assess your overall health and will consider things such as your current cardiovascular condition, any complications with your eyes or vision, or any prior nerve problems. Your doctor will be supportive and encouraging of your goals to engage in exercise and can help you make informed decisions about what is best for you and what to avoid. If your doctor has determined that specific complications from your diabetes might make certain exercises unsafe, please consider visiting the American Diabetes Association's website to access their fact sheet, Exercising with Complications of Diabetes. We have linked this on the slide for a great and informative list of exercises to avoid, as well as suitable alternatives. Take extra care. For anyone with diabetes, there are some simple pre-activity guidelines that we recommend. Fuel your body properly. A high-protein, nutrient-dense meal is always a great choice before you engage in physical activity. Check your sugars. Ensure that your blood sugar is in an adequate range before you begin exercising. If your blood glucose level is low prior to engaging in physical activity, you are at risk of a hypoglycemic event, which can be dangerous. If your blood glucose level is too high, your body is not producing enough insulin to allow your cells to use blood glucose for energy, and your liver will break down fat for fuel. During this process, an acid called ketones are released in the body. Exercise further promotes this process and can lead to a dangerous buildup of ketones, otherwise known as diabetic ketoacidosis. Carry carbohydrates. Sometimes, even with the best preparation, exercise can decrease your blood glucose levels more rapidly than expected. It is always best to carry a fast-acting carbohydrate option in case you experience low blood sugar, such as glucose tablets, gummy candy, or juice. Consider a medical bracelet. It is possible that while exercising, you may be away from home, and you could be surrounded by people who are unaware of your diabetes. In the unlikely incident that you are injured and need assistance, it is always best to wear a medical bracelet indicating you are a person with diabetes. Medical professionals, such as EMTs, are trained to check a person's wrist for this important information. Wear supportive, well-fitting shoes. People with diabetes need to wear shoes that provide a lot of cushioning and comfort to help prevent diabetic foot complications. Select footwear that offers plenty of heel and arch support and cushions the ball of the foot, the padded part of the sole between the toes and the arch. Hydrate. While low-impact aerobic exercises may not require you to drastically increase your hydration, it is helpful to be aware that exercise can lead to dehydration. Dehydration is particularly impactful for a person with diabetes and should be avoided whenever possible. The American Council on Exercise recommends 8 ounces of water 30 minutes before exercising, 7 to 10 ounces of water for every 20 minutes of exercise, and 8 ounces of water within 30 minutes of concluding your exercise. Rest as needed. Exercising too intensely can cause exercise-induced fatigue. It is always better to take a break, especially if you feel lightheaded or unsteady on your feet. You can lower your intensity level or restart your workout when you feel up to it. If you feel any sudden discomfort, stop. Discuss your symptoms with your doctor to ensure there are no underlying causes for your discomfort. While some soreness or stiffness may be normal and expected when you begin an exercise regimen, any sudden change or noticeable new pain is worth discussing with your doctor. Start slow. The goal is to get at least 150 minutes per week of moderate intensity physical activity. One way to do this is to try to fit in at least 20 to 25 minutes of activity every day. This doesn't mean that you have to carve out time each day to head to a gym. Some practical examples of moderate intensity physical activity that can be easily added towards your weekly goal include walking briskly, doing housework, mowing the lawn, dancing, swimming, bicycling, or playing sports. If you're new to exercise, you should start slow. Gauging the intensity of a workout can be tough, so we recommend the talk test. In general, if you're doing moderate intensity activity, you can talk but not sing during the activity. If you have escalated to doing vigorous intensity activity, you will not be able to say more than a few words without pausing for a breath. Low-impact workouts such as yoga, Pilates, or Tai Chi can also help to break up your week's worth of activity. As an added bonus, these exercises are excellent ways to increase strength, flexibility, and balance. And don't forget, incorporating rest and hydration are as important to your overall wellness as the physical activity itself. Find a buddy. When you work out with a partner, you're more likely to feel motivated. When you and your buddy encourage each other, you'll work harder and get better results. Plus, there's nothing wrong with a little friendly competition. Be more adventurous. It's easier to try new things with a buddy. You may just find an activity that you love, one that feels more like fun and less like a workout. Be more consistent. When someone else is counting on you to show up, you won't want to let them down. To enjoy all of these benefits, you'll need the right workout buddy. Look for someone with the same goals, schedule, and commitment that you have. Someone who makes you feel positive and inspires you to keep up with your health goals. Once you have identified a great buddy to share your experiences with, you should fill them in on your diabetes. You can share a few simple suggestions of how they can assist should you experience any blood sugar lows or other complications as a result of your exercise. Options for exercise. One great tip to help you remain motivated and excited about exercise is to make a list of fun activities to try, places to visit, or communities to become involved with. Social media can be a great resource for this, but if you prefer to do your research offline, start a collection of community newspapers or magazines that feature local events. You can walk through a farmer's market, attend a dance night at your local community center, or go for a nature hike with your local Audubon Society. These are all amazing ways to change up your exercise routine and can be fun events to look forward to. Of course, life can be incredibly busy. Between work, family, and competing obligations, exercise can feel like just another task added to the list. Squeezing 20 minutes of activity into your day can be simplified. A self-guided home workout is a great option. Strength training or resistance exercise is an excellent, low-impact, low-cost way to increase your activity in shorter intervals. Strength training or resistance training can be a particularly effective tool for people with diabetes to manage their condition because it improves blood sugar control and boosts cardiovascular health. It can also improve insulin response, prevent bone loss, and support healthy weight management. Strength training also helps you to retain or gain lean muscle, which is important to supporting a healthy metabolism. Make it a habit and reward yourself. Creating a new habit will take time, effort, and consistency. Some studies suggest you will actively commit 2 to 3 months to consistently practicing a new behavior before it starts to feel like second nature, and that certainly may be true of your daily exercise goals. Associating exercise with another daily activity can really help to build its permanent place in your daily schedule. If you commit to taking a 20-minute walk after lunch every day, eventually, each day at lunch, you'll feel compelled to get your walk in as a force of habit. Relative to diabetes and exercise's impact on your blood glucose levels, experts also suggest that eating, taking your medications, and exercising at the same time every day can be extremely helpful. Not only will this contribute to building and maintaining a healthy routine, but it will also help you track and observe any potential changes to your blood glucose levels as a result of adding exercise. Keeping a daily log can also really help. At first, while you work towards consistently prioritizing time each day to being physically active, it might be encouraging to set small goals and reward yourself for meeting them. Rewards can be simple and low cost, but still help to keep up that daily motivation. Participate in the Good Health Gateway. The Good Health Gateway Diabetes Care Rewards Program is here to support you in all of your endeavors towards better health. November is National Diabetes Awareness Month, and there is no better time to prioritize yourself, increase your knowledge surrounding diabetes, and learn more about practical and sustainable fitness habits to help you become your healthiest. The CDC reports that the most common reasons people with diabetes become discouraged about physical activity are: it's just too hard, the results take too long, it's not fun, it costs too much, or it's hard to find the time. These are all valid challenges and concerns, but fortunately, the Good Health Gateway team is here to encourage you. When you're ready to take the important first step of starting an exercise regimen, call our team. The tips and tricks shared in the presentation today are helpful for most, but beyond that, we offer you unlimited access to personalized support from our team of certified diabetes educators. Call toll-free or visit our website at goodhealthgateway.com. We are here for you.